Your bladder urgency might not be about your bladder, it could be about your brain sending the wrong signals. 5 evidence-based techniques can retrain this communication system and reduce urgency episodes by 70% in 8 weeks. I'm going to walk you through 5 clinically proven bladder training techniques that systematic reviews show work for 9 out of 10 people who used them consistently. These aren't generic lifestyle tips, they're specific protocols backed by decades of urological research. Your bladder is essentially a muscular balloon designed to comfortably hold 300 to 500 milliliters of urine. But when you have an overactive bladder, your detrusor muscle, that's the main bladder muscle, starts contracting when it should stay relaxed. Here's what's fascinating. Your brain receives these premature contraction signals and interprets them as emergency, bathroom now. But here's the key insight from recent neurology research. You can retrain this communication. The International Continence Society now classifies bladder training as grade A evidence, the highest level for the treatment of urgency and frequency. That means it's as scientifically validated as any medication. Technique 1, progressive interval training. This is your foundation technique. You start by tracking your natural voiding patterns for 3 days. Most people with an overactive bladder go every 45 to 90 minutes. Once you know your baseline, you set a comfortable starting interval, usually your average time plus 15 minutes. So if you're going every hour, you start training at 75-minute intervals. Each week, you increase this interval by another 15 to 30 minutes. The goal is to reach 3 to 4 hour intervals, which is the normal bladder capacity. Clinical trials show this technique alone achieves 60 to 75% symptom reduction in most patients. The key is consistency. You need to stick to your scheduled times, even if you feel a mild sense of urgency. Technique 2, the urge suppression protocol. When that urgent feeling hits, most people panic and rush to the bathroom, but research shows this actually reinforces the problem. Instead, try the 5-5-5 technique. Take 5 slow deep breaths, do 5 quick pelvic floor contractions, think of stopping your urine midstream, then distract yourself for 5 minutes with a mental task like counting backwards from 100 by 7s. Studies in neurology and urodynamics show that patients who use this protocol reduce urgency severity by 65 to 80%. The urgency doesn't disappear immediately, but it becomes much more manageable. And here's why this works. You're literally rewiring the communication between your bladder and brain. Each time you successfully delay voiding, you're strengthening your prefrontal cortex's ability to override those premature urgency signals. Technique 3, strategic delayed voiding. This builds on urge suppression. When you feel the urge to urinate, instead of going immediately, you wait 5 to 10 minutes first. Start small. Even a 2-minute delay counts as progress. Gradually increase this delay time as your confidence grows. The 2023 Systematic Review in Neurological Research shows this single technique reduces urgency frequency by 55 to 70% when practiced consistently for 6 weeks. What's happening physiologically? You're teaching your detrusor muscle that those early contraction signals aren't actually emergencies. Your bladder learns to relax and hold more volume. Technique 4, integrated pelvic floor training. Your pelvic floor muscles work like a hammock supporting your bladder. When they're weak, they can't help suppress those unwanted bladder contractions. The technique is simple but specific. When urgency hits, do 5 to 10 quick pelvic floor contractions. Imagine stopping urine flow or picking up a marble with your vagina or lifting your testicles. Then immediately do 3 to 5 long, sustained contractions. Hold for 10 seconds each. This combination is what research shows works best. Studies demonstrate that combining pelvic floor training with bladder retraining improves outcomes by an additional 15 to 25% compared with bladder training alone. Technique 5, precision fluid management. Here's where most advice gets it wrong. People think that drinking less water helps with bladder problems. Actually, concentrated urine irritates your bladder and worsens urgency. The evidence-based approach is to drink 1.5 to 2 liters daily, but front-load your intake. Have most of your fluids before 6 p.m. This maintains healthy urine dilution while reducing nighttime urgency. Avoid bladder irritants like caffeine, alcohol, and acidic drinks during your training period. The 2022 Australian Continence Foundation guidelines show that this complementary technique improves success rates by 20 to 30%. Now let's talk about the timeline because it matters for success. Weeks 1 to 2 are your learning phase. You're mastering the techniques, but don't expect dramatic improvements yet. Weeks 3 to 4 are when most people notice initial improvements in urgency frequency. Weeks 6 to 8 are typically when significant symptom reduction becomes apparent. Maximum benefits usually occur around week 12. Recent research shows that patient compliance above 80% predicts success more than any other factor. The realistic goal isn't perfect bladder control. It's substantial improvement in quality of life. Most successful patients reduce their urgency episodes by 70% and extend their voiding intervals to 3 to 4 hours. Now, an important safety note. Before starting bladder training, you need medical clearance to rule out underlying conditions. See your doctor immediately if you have blood in your urine, recurrent infections, or sudden onset symptoms. Bladder training works best for overactive bladder and urge incontinence. It's less effective for stress incontinence or overflow incontinence. If you're unsure about your type, get a proper assessment first. If you see no improvement after 8 to 12 weeks of consistent practice, or if symptoms worsen, return to your healthcare provider. You might need additional treatment or investigation. If you find these evidence-based techniques helpful, subscribe to MedHeads for more practical medical education that you can actually use. We translate complex research into actionable protocols. I'm Dr. Fergal Armstrong, and this has been MedHeads.